Hey guys, we're almost there. Let's talk a little bit about exercise for people with fibromyalgia. I think this is the next to the last chapter that's covered this semester. So I'm going to go ahead and share my screen and we'll get going on that. All right, like I said, we're going to talk about fibromyalgia today. Some of you may have this, some of you may know someone who has it. It's a difficult uh, thing to deal with. Part of the reason is that it's kind of one of those invisible situations. You're in pain a lot, things like that. You don't feel like doing much. You don't have energy. Because it's not something that the average person can just see by looking at you, then they consider you a hypochondriac, perhaps, or lazy, or a wimp. Things like that, when you actually have a condition that is causing the things that you're dealing with. So let's talk a little bit about fibromyalgia, what it is, and how we can program for people who are dealing with fibromyalgia. So first off, what is it? It is a chronic disorder characterized by fatigue and widespread pain in the muscles and bones. As it says here, it is not life-threatening, it's just present. It significantly diminishes quality of life. You don't feel like doing things, you don't feel great. It is a rheumatic disorder, is what it's classified under. Rheumatic disorders are basically just diseases that affect muscles and joints. And there's three common types of rheumatic disorders. Osteoarthritis, we've talked about it and how that's the degenerative breakdown in our joints. Gout and lupus, those are three different types of rheumatic disorders. Osteoarthritis, again, rheumatic disease. It is our wear and tear arthritis. What happens there is the cartilage at the end of the bones is going to wear down. It lets bones end up bone on bone instead of cartilage on cartilage. And it promotes joint pain, swelling, stiffness, breakdown. That's where you run into a lot of joint replacements, knee replacements, hip replacements, because the cartilage is gone at the end of those bones. And it's once you get to bone on bone, then you're going to have pain, swelling, stiffness, breakdown. The quality of life will be diminished to the point that people have to get something done. So that's how that moves along usually. Gout is another rheumatic disease. What happens there is uric acid crystals start to accumulate in joints. This is very common in the big toes. You have sharp joint pain, you have tenderness, swelling, stiffness, usually lasts for hours, days, or weeks. So it really is kind of wide range of how long your symptoms can go on. And the problem is that you get unpredictable flare-ups with gout. You don't really know when it's going to happen. Now, there's some precursors. Red meat, I think, can be a cause of gout or something that can cause a flare. So if you are a sufferer of gout, you usually can come up with some, okay, what did I do prior to this happening? So it can become a little more predictable through time as you start having flare-ups. If you start seeing something consistent happening, you can figure out what is causing it. Lupus, it is also a rheumatic disease. It's an autoimmune disorder. It affects various organs through the body. So when we're talking about organs, we're talking about pretty serious items going on here. You're going to have symptoms that include joint pain, stiffness, fatigue, hair loss, kidney problems, anemia, rashes, and blue or white fingertips in cold environments. So that shows you that you're not getting circulation that you need to get. You're going to be colder than normal, probably in a cold environment. A lot of different symptoms here. So you probably have to go through a process of elimination again to figure out for sure whether someone has lupus, because a lot of those symptoms can be attributed to other things as well. Symptoms that we're going to see are musculoskeletal pain, particularly in the neck and back. We're talking about fibromyalgia now. What symptoms are we going to see? Musculoskeletal pain, neck and back, chronic fatigue and headaches, stiffness, particularly in the morning. As I'm going through this slide, I'm like, do I have fibromyalgia? Because I have basically a lot of the first three I can make check marks on. Disrupted sleep, okay, I'm up to 4. Tingling and numbness in the hands and feet, no. Dizziness, no. Instability, depends on whether we're talking about mental or physical. And then there's something that's called fibrofog, which is, we'll talk more about fibrofog later. I'm pretty sure there's a slide for that as well. Matter of fact, it was next. Fibrofog is just basically an occasional lack of mental clarity. It goes from 30 to 90 seconds. There's short-term memory loss, inability to concentrate, lack of attention, distraction, forgetfulness. The person is unable to follow conversations and integrate new information. So if you're telling them things during a bout of this fibrofog, they're not going to take it in like they would normally. Fibrofog is not anything that you really can get. It's kind of like you just zone out, go into a daze for 30 to 90 seconds. Kind of similar looking to a very mild seizure, perhaps. There's no cure for it, but it's been shown that adequate exercise and deep sleep can help with this to prevent it. So, pain perception in someone who has fibromyalgia. Fibromyalgia patients, they have a lower overall stimulus threshold for pain. So what that means is something that gives us, on a scale of 1 to 10, a pain of 3. For them, it's probably going to be a pain of 8. So their pain stimulus is, their threshold is much lower than for someone who does not have fibromyalgia as far as how they perceive their pain to be. It's not really any stronger. It's just the way that their body takes that signal and processes it. So the painful stimulus is going to activate the central nervous system, obviously, the sympathetic nervous system, and the HPA axis, hypothalamic pituitary adrenocorticotropic. I get extra points for even saying that correctly. Axis. Those are the things that a painful stimulus is going to activate. Your CNS, central nervous system, integrates all sensory information. It receives info from the pain receptors called nociceptors. It receives emotional input that influences subjective interpretation of pain intensity. So your CNS it feeds off of emotional input from the individual, and it influences how that individual is going to interpret the intensity of their pain. So this shows why it is subjective interpretation. Your SNS reacts to and prepares the body during times of stress. This is where you see things like the fight or flight reflex. The HPA axis connects the central nervous system to the endocrine system. So your central nervous system may tell your endocrine system to release hormones, things like that, into the body. And when things are put on hyperdrive or running off kilter, then some of these things that start happening, your SNS may be overreacting, preparing your body for something stressful when it's really not that stressful. So it can give you anxiety, things like that. You could have hormones released into the body that are not necessary at a given point. Let's see. So as far as the abnormalities and the pain processing in someone who has fibromyalgia, and this is important, again, guys, I'm trying to give you an opportunity to understand what each one of these special populations is going through. Why is it happening? How can we help them to understand what's going on with them. Because in a lot of ways, yes, this is an exercise class, but without understanding what's going on in each one of these, then we can't help them. So the abnormalities in the pain processing comes down to high levels of pro-nociceptive neurotransmitters, low levels of inhibitory neurotransmitters. So you get more pain signals sent through because you don't have any inhibitory neurotransmitters slowing down some of the pain. Dopamine dysregulation, low levels of growth hormone, and high levels of nerve growth factor. And we know that nerves are, what we use to, when we say, hey, you're getting on my nerves, is that a positive? No, that's a negative. When we put our hand on a hot stove, which I try not to do intentionally, you're going to, what causes you to feel the pain is a nerve that's there. So when you have high levels of nerve growth factor, your nerves become more and more sensitive and active. Diagnosis is hard for fibromyalgia because there is such a wide range of pain and there's so many symptoms that are possible. So the newest diagnostic criteria that's come out for diagnosing fibromyalgia, you're going to see widespread pain that lasts at least 3 months, debilitating fatigue. You're going to see consistently difficulty concentrating, and they have no other underlying conditions that can explain the conditions that they're having. But they got to have widespread pain for 3 months, debilitating fatigue, and difficulty concentrating. That's that fibro fog we were talking about. Fibromyalgia also often have low blood iron levels, so they have a form of anemia a lot of time. The role of iron in the body is that it's required for red blood cell production. And what red blood cell production does, it gives us the ability and ample amount of oxygen carriers in our blood. Iron helps to transport oxygen in the blood. Iron is also required for serotonin and dopamine production, and these have a lot to do with our moods. Some things that can promote the development of fibromyalgia: genetic predisposition. There is a genetic tie. Traumatic events play into it. Repetitive injuries, viral infections, presences of other rheumatic diseases, gender, more common in female, and obesity, more common in people who are obese, as are many detrimental health factors. The treatment for fibromyalgia, there's drug-based methods where serotonin and norepinephrine levels are altered. Things are done to improve sleep quality through drugs, and those help. We said how that can improve the fibro fog. There's some non-drug based methods also. One is called transcranial magnetic stimulation, vagus nerve stimulation, physical activity. Okay, that's why we're here, has been shown to be a positive. Dry needling. Some of you may have actually even had this done before. Myofascial release therapy, where you have super tight muscles. These are ways to help release the fascia and get rid of some of the pain that people are having. When some of these muscles are released, where you've got extreme tightness, obviously your pain is going to go down. So, precautions during exercise for people with fibromyalgia. Obviously, they have widespread pain. We've covered that. That's their most common symptom, is widespread pain. Also, the pain is going to be in the form of stiffness, aching, burning, stabbing, and even sometimes radiating. The intensity of pain is going to vary based on activity level, hydration status. Water is important. Time of day for each individual person. And we talked about how these exercise protocols need to be individualized. and the person's stress level. If they have a high stress level, usually their fibromyalgia symptoms are at a higher level as well. Generalized fatigue and disordered sleep is something else to watch out for. Fatigue can be due to this disordered sleep. Sometimes fatigue is all-consuming listlessness. The person just doesn't want to do anything, doesn't want to get out of bed, doesn't want to get up out of a chair. You got to be a good motivator. How's it hard? I mean, how easy is it to get someone who's in a state of all-consuming listlessness to want to exercise for you? You got to be careful to work within and not beyond the patient's limit. They do have a limit. Their pain threshold is lowered. You don't want to take them too far beyond where they need to go. You need to get them active, but you don't need to overdo it and make their pain worse, or they will not be back. Some other precautions, another one is poor balance. Obviously that increases fall risks, and we've talked about how they already have a lower pain tolerance, so you definitely don't want to have them falling. That's just another pain that's possible. So what you need to do as a fitness professional is design exercises that consider this, increased fall risk because of poor balance. You're going to consider potential balance issues in what you're going to offer them. You don't want to do activities that include balance as the main component. You don't want to do quick change of directions one way or the other. If they're off balance, they may fall. Uneven flooring, things like that play into balance issues. So those are just some things to think about. Another thing that plays in is irritable bowel syndrome. Obviously, if this is going on, it might interfere with the ability to exercise. It's hard to exercise when you need to poop. There's unpredictable bouts of constipation and diarrhea. You're going to see bloating, cramping, and gas. Those are things that are seen in irritable bowel syndrome. So you think about what's going on here. Think about how that would play into exercise. Not very beneficial. Another thing that's seen is urinary bladder irritability and incontinence. We've talked about this with the elderly. I think we talked about this with multiple sclerosis, if I'm correct. This also might interfere with the patient's ability to exercise. And what they're going to do, as we've said before, they're going to start trying to limit their fluid intake to avoid the necessity to urinate. So what you need to do is encourage frequent water intake to make up for the fact that they're trying to avoid drinking fluid, and provide ample rest breaks, aka bathroom breaks. So benefits of exercise for people with fibromyalgia: you're going to see increases in bone density, improved cardiorespiratory functioning. You're going to get to a healthier weight. When you're at a healthier weight, your body's going to feel better. You're going to have less pain overall. Because of being at a healthy weight, feeling better about yourself. And we know that exercise just in general improves mood. So the improvement of mood is another thing that we see. So what goals do we have when we're doing exercise with people who have fibromyalgia? We want to promote optimal individual muscular, cardiovascular, and skeletal fitness. We want to alleviate muscle and joint pain, optimize overall health and well-being, avoid overexertion, therefore staying away from worsening of their symptoms, encourage exercise compliance. That is a challenge for people with fibromyalgia. We talked about how they have tiredness, listlessness. They don't want to get up and move. So exercise compliance is difficult. You have a lot of dropouts, obviously, from people who are dealing with fibromyalgia. You also want to ease the effort that's required for activity of daily living and for leisure activities. So exercise can help to make this better. Barriers to exercise. These are big for this population. They have a fear of worsening fibromyalgia-related symptoms, and excessive physical activity can make pain worse, can cause a flare-up. If you let that happen, are they coming back again? No. Another thing that is a barrier to exercise in this group is that they have embarrassment over their poor fitness level. We talked about how they've been sedentary for the most part for their whole lives, or at least once they started having this listlessness and lack of energy. So they're not in very good shape. So this makes them self-conscious about their level of fitness. I mean, who loves going to a gym your first day and you've got all these, gym rats in there that are all chiseled and cut, and you feel like the fat kid, and that's no fun. And that's what they're getting. They feel embarrassed because their fitness level is low. As far as exercise testing, fitness professionals and their fibromyalgia clients, they always need to check with a physician, physical therapist, or clinical exercise physiologist for guidance during exercise planning, and just follow the physician's advice on exercise testing for this group. You don't want to make it too difficult if you do exercise testing, because again, you don't want to run them off before they ever even get started. So, general guidelines for exercise prescription: check their pain level daily and frequently during a session. Don't let them overexert. Choose activities that the client enjoys and can perform with proper body alignment. Aquatic therapy is excellent, excellent, excellent for this particular population. For aerobic and resistance training, begin with lower intensity than is indicated by the age predicted norms. So you're going to start off lighter than you would even think that you should. Progress very slowly, and know, again, that compliance is often poor in this population because they just don't feel great. They don't want to exercise. Exercise prescription. Okay, here we've gotten to the point where this is something you can take with you, something I'm not going to test you on right here. Begin all exercise with 5 to 10 minute low intensity warm up. Include limbering movements. Avoid static stretching early in the warm up. Treadmill walking or stationary cycling are safe and effective ways to slowly warm up for exercise for someone with fibromyalgia. As far as cardiovascular training, you want to do 1 to 2 aerobic exercise sessions a week, gradually progressing to 2 to 3 sessions a week. If you can keep things at the proper level, keep them engaged. That's where you want to get. Exercise for a duration of 10 minutes, gradually progressing to 30 to 60 minutes as tolerated by the individual. And this may change day to day depending on how they're feeling. Work at a moderate intensity, initially less than 30% of VO2 reserve, with a gradual progression 40 to 59%. Cycling, water exercise, and swimming, again, great mediums to use for cardiovascular training. Don't do interval training. It's usually too intense for this population. Just something to note. As far as resistance training, you want to do this 2 to 3 days a week, minimum of 48 hours in between resistance training sessions. 8 to 10 exercises target major muscle groups. Work at an intensity that permits 8 to 12 reps per set. So you don't want to go super high, probably close to the 60% of 1 rep max. 8 to 12 reps a set. Allow 2 to 3 minutes of rest in between sets. For endurance training, instead of strength training, you want to keep the intensity at or below 50%, include 15 to 25 reps with shorter rest periods between. So that's when you're working on endurance training versus strength training. For flexibility training, and this can actually help a lot with this particular population, 1 to 2 days a week, you want to do this at the start. Progress to 5 days a week. You want to include active, gentle stretches in the pain-free range for all muscle groups. Hold these stretches for 10 to 30 seconds, progressing to 60 seconds as tolerated. Again, their pain threshold is lower. So stretching, to me, hurts. If I had fibromyalgia, it would probably really hurt. I would really hate stretching. So if it looks like they're not really stretching very hard, it's probably because it already hurts them. Something just to think about and know who you're working with. And that's why we go through so much about what is going on with these different populations. Some special considerations. Some of these we have already touched on. Be aware of potential balance issues. You're going to want to do things like keeping the floor clear of clutter. Duh. You're going to avoid slippery surfaces. Duh. Incorporate balance training into the workout. So if you're right there with them, if you can work on balance to make it better, absolutely, good idea. But you need to be right there with them. If you're challenging them for balance and they're already having issues with that, don't walk off and let them fall. Minimize the eccentric component of exercise. Know what eccentric is. Avoid overtraining at all costs. If you do that, you will run them off. Encourage proper hydration and frequently assess the client's rating of perceived exertion. How hard are they working according to them? You want to not get up toward the top end. If you have an exertion scale where you're running up to 20, you don't want them from 16 to 20. That's hard. That's getting after it. If you get them there, they're gonna overdo it quickly. All right, sample exercise program. Again, take this with you. I'm not gonna ask you to list it. 5 to 10 minute warm up using a treadmill or exercise bike, limbering arm movements, and some mild stretches. There's your warm up. So as far as your core, good to work with every group. Seated abdominal squeezes, basic crunch, reverse crunch. Now in the book, and I still think some of y'all haven't gotten this book. If you haven't, you need to get it. These crunches, all of these exercises are shown in the book. So go through and keep this book if you're planning on working in the exercise field. It has a lot of good information. It's got pictures of each one of these things being done, explanations, good stuff. So it's not you're not going to get a bunch for it anyway. This is a book that I would keep. I sold too many books when I was going through school. Lower body exercises, and notice these are not super duper difficult, intense. Sit to stand. That's working on activities of daily living right there. Wall squats, calf raises, toe lifts. These sound pretty easy to us. To someone with fibromyalgia, not so much. Upper body exercises, things like lat pull down, push-ups on the knees, makes it a little easier. Shoulder press, bicep curls. These are just examples. These are not what you would do with everybody. Again, why I'm not going to test you on this, but this is good information to build as a foundation when you work with someone who has fibromyalgia. This is good stuff to pull from. As far as flexibility exercises, hip flexor stretches, gluteal stretches, calf stretches, and chest stretches. I said that I hate stretching, and I do. But because of that, I have gotten very tight through the years. I do hip flexor stretching at night in the bed every night, gluteal stretch as well, and chest stretches because I tend to slump forward and my chest is pulled in all day. So it feels really good to stretch my chest back open because of my poor posture, honestly. Calf stretching is about the only one here that I don't do a lot of. And I don't even like stretching at all. As far as nutrition, we go through this in every chapter. Research hasn't shown a relationship between diet and disease progression of someone with fibromyalgia. They just need to be encouraged to eat a diet that's considered healthy for the general population. Some nutrients of special concern. Antioxidants, they help protect the body from oxidative stress. some research indicate that oxidative stress promotes fibromyalgia. So antioxidants help to protect the body from this oxidative stress, then obviously that is a positive. Evidence supporting this, supporting antioxidant supplements is limited. You want to just consume amounts that are recommended to the general public. Gluten. Fibromyalgia patients often have gastrointestinal discomfort with symptoms resembling those of IBS, irritable bowel syndrome, and or celiac disease. Pretty bothersome conditions. A lot of times, when you're dealing with these things, they'll look at trying a gluten-free diet. So some preliminary research is supporting a gluten-free diet for people who are dealing with fibromyalgia, but there's not enough research yet to make experts recommend a gluten-free diet for everyone across the board with fibromyalgia. People with, according to the National Fibromyalgia Research Association, people who have fibromyalgia need to limit, and I think this fits for not just people with fibromyalgia, I think this covers all of us, basically. Refined, sugary foods, caffeine, alcohol, fried foods, red meats, and highly processed foods. They're really pushing the box on this one. This is common sense here, guys. This fits for everybody that is in this class. You need to limit the things that are on this list. So yes, of course, people with fibromyalgia should limit those as well. And we have covered the fibromyalgia chapter. So thank you for hanging in there. We're almost done. I think we have one more lecture for me to do for you guys. Hope your semester's going well. Y'all have a good rest of the day, and I will talk to you later.